Young adults cannot spread COVID-19 at the kind of rates we've seen without eventually exposing and infecting older, more vulnerable groups, from people they don't know out in public to older coworkers, and of course parents and grandparents. And unfortunately, that's what we're now seeing in the stats. That started in late June and then it accelerated through July. And it's now driving a growing number of infections in nursing homes, which could unfortunately drive another wave of deaths yet to come.
As folks have gone out in public without masks, without practicing social distancing, and we've seen the result of that in terms of a spike in cases, naturally that spike occurs inside the long-term care communities as well, no matter how hard or how disciplined our members are about trying to prevent it.
COVID-19 cases in long-term care facilities have gone up more than 150% since the end of last month. Staff cases have gone up more than 125%. And the nursing home industry says there is a disconnect in Washington because they don't know when or which facilities will be getting the rapid tests supposedly coming from the federal government, and they claim to be getting shoddy equipment from the feds.
You've heard and you've seen that FEMA did provide PPE. Unfortunately, in our particular case, that PPE was substandard. We could not utilize those items.
Now, the state administration requires senior care staff to be tested every other week, though the federal guidelines recommend testing staff every week. But the state is not requiring ongoing tests of the elderly residents most at risk.
We are in the midst of catastrophe. There is a Category 5 emergency.
And President Trump inadvertently exposed the disconnect in Washington.
I think we have one of the lowest mortality rates in the world. We're going to take, I heard we have one of the lowest, maybe the lowest mortality rate anywhere in the world. Do you have the numbers, please?
Well, the president's press secretary gave him a chart which he cited as proof of the United States having the lowest mortality rate in the world.
Number one low mortality rate. I hope you show this scenario because it shows what fake news is all about.
Okay. This graph he held up is one of those make-it-yourself graphs from the Your World in Data website. And whoever made this one the president is holding clicked on case fatality rates, added a couple of countries with case fatality rates higher than the United States, and then the president passed it off as a chart proving we have the lowest mortality rate in the world. Well, first, look what happens when you use the same interactive tool on the same website to randomly select other countries. You see many have lower case fatality rates than the United States. But second, that chart shows case fatality rates, not mortality rates relative to population. The case fatality rate is a different metric. It's the number of deaths among those who test positive. And our World in Data, which the White House used to make the chart, notes that the case fatality rate is a poor measure of the mortality risk of the disease. As more people test positive and deaths generally lag infections by weeks, case fatality rates have gone down. But mortality rates, which measure COVID deaths per million people, show the United States has among the worst in the world. But that point gets lost in the disconnect in Washington, just like the disconnect on testing.
We are the envy of the world, they call, and they say the most incredible job anybody's done is our job on testing.
Testing is up 37%.
Well, that's good.
I understand. Cases are up 194%. It isn't just that testing has gone up, it's that the virus has spread.
On testing, the president's correct in stating we do more total tests than anywhere in the world, but experts say testing should be measured based on the scale of the population and the scale of the outbreak. And for example, when you measure total tests per 1,000 people, the United States ranks around 11th in the world.
75,000 cases a day.
Show me the death chart.
The death chart is 1,000 cases a day.
Excuse me. It's all too much. It shouldn't be one case. It came from China. They should have never let it escape. They should have never let it out. But it is what it is.
But it's not what it is when it comes to COVID-19, and that brings us to one of the biggest disconnects of all that we see in the White House, on both sides of the aisle in Congress, from Tallahassee and all places in between. Our policymakers have been making assumptions and decisions based on what the virus appears to be doing, but the problem is there's always a lag in the trends. For example, new cases reported each day are days old, and now often weeks old due to the growing backlog in processing the tests. And the daily death counts don't mean that many people died that day. It just got reported to the state that day. The deaths often occur weeks before they're reported in the stats, and the symptoms often set in weeks before that. Looking at these charts can be like looking at stars in the sky. Because it takes so long for the light to reach us, we don't know if the trends we're seeing still exist any more than those points of light in the sky. And yet states like Florida skipped over the federal guidepost in reopening because at the time the trends looked good. They downplayed the severity of the outbreak, not seeing the true death count due to the lag in reporting the fatalities. Well, the good news is that a growing number of politicians across the aisle now seem to be recognizing this and responding as such. This week, President Trump moved from showing those maps to canceling the RNC in Jacksonville, urging people to wear masks and saying it will probably get worse before it gets better. Meanwhile, Florida polling shows 79% now think masks should be required when going out in public. And the IHME model cited by the federal government shows that changing attitudes and behavior could make a big difference in Florida. That model for Florida indicates that it could in fact save more than 6,000 lives in the next 3 months.